All right. So welcome everyone. This is our April edition of Tri-State Connect. My name is Mary Beth Bova-Cadillac and I'm the Director of Patient Education and Support for the Scleroderma Foundation Tri-State Chapter. And the Tri-State Chapter is a affiliate of the National Scleroderma Foundation. We're based in Binghamton, New York, and we cover New York, New Jersey, and the northern section of Connecticut. Or not all of Connecticut, northern section of New Jersey. There we go. So welcome to Tri-State Connect. The recordings, this is a recorded conversation, so we'll post this on Facebook and you can find it there soon after this presentation is done, maybe within a week or so. We put it up so that you can go back to it and revisit some of the information. So the topic, we have our guest speaker, Maxwell Green. He's the project manager and webinar training manager at NeedyMeds. And Maxwell has a BS in business with a concentration in human resource management, not human resource management, that's me, concentration in management from Westfield State University. His relevant experience ranges anywhere from database sales to data entry. He has a passion for research. He likes working with raw data. And so it seems like he's a good fit for the kinds of programs that NeedyMeds needs. So Maxwell, I'm going to turn the presentation over to you. You can take it from here. Okay?
Okay, great.
Just make you the presenter. Okay.
Okay, great. Thanks, Mary Beth. I appreciate the introduction. And thank you, the Scleroderma Foundation, for hosting me today in your webinar. As Mary Beth mentioned, I'm a training manager and a project manager here at NeedyMeds. You're here today because maybe you have difficulty paying for your healthcare expenses, or perhaps you're here to learn how to help your patients or clients find help. Today, I will teach you how to find patient assistance resources on the NeedyMeds website, and you will also learn a few tips about applying to these resources. I will be taking natural pauses throughout the webinar, so please save your questions for these pauses or until the end. For any technical issues that may arise, such as sound or video not working properly, please address these in private chat to me, or feel free to interrupt me. This webinar will be recorded, but you can find a similar one on our webinar library page under the Getting Started tab of the NeedyMeds website. I will provide my contact information at the end should you have any other questions or would like a copy of the presentation. Lastly, if I'm going too fast or too slow, please let me know, but keep in mind the webinar will be recorded so you can revisit it later. Okay, so who is NeedyMeds? Here's the NeedyMeds homepage. NeedyMeds is a national nonprofit organization. It was founded in 1996 by a retired physician, Dr. Sagal, who is our current president. He discovered patient assistance programs and wanted every patient and every physician to know about them, so he created a website. The face of our organization is our website, and it's used as an informational resource. Through our website and toll-free helpline, we connect patients to programs that provide financial assistance for healthcare expenses, including, but not limited to, medications. We do not offer financial assistance, but we refer patients to programs that do. 1.3 million people use the website each year, from patients to healthcare professionals to social workers to patient advocates. Our website began with just a handful of patient assistance programs, but today has over 7,000 points of cost savings. The information is accessible online, at no cost, without registration, so you can remain completely anonymous. You will find financial assistance programs under the Patient Savings tab on the website. Always start by looking for PAPs, or Prescription Assistance Programs, because those provide free or deeply discounted medications. Okay, so what are PAPs, or Prescription Assistance Programs? Prescription Assistance Programs are sponsored by pharmaceutical companies. They provide free or discounted prescription drugs to those that qualify. There's no law requiring pharmaceutical companies to do this, so each company does its own thing. They do it to be good corporate citizens. Not every drug will have a prescription assistance program, and the eligibility requirements and applications vary from program to program. Some will help uninsured people, others will help those with insurance but without drug coverage, Still, others may help people who have drug coverage but cannot afford their copayments. It varies from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved. This means providing a prescription for the medications and signing the Prescription Assistance Program application. So where can one find more information about prescription assistance programs? Well, that's where NeedyMeds comes in. And with that, I'll begin the tour of our website. Okay, so this is the NeedyMeds homepage. You can search for medications in this drug search box here, although we encourage you to use the Patient Savings tab as there's more options available. You can search by drug by brand name, generic name, name of the pharmaceutical company, or name of the application. Right now we're going to try a brand name search for the drug Altace. So we'll click on brand name drugs. You'll see some icons here at the top, and what those icons represent is the type of information that you can access once you choose a drug below. Some drugs might have a coupon, some might have a prescription assistance program. It really varies, so just familiarize yourself with the icons at top before you choose a drug below. Okay, so like I said, we're going to search for the drug Altace. So we'll click A. We'll scroll down, and we'll find Altace. Okay, maybe it is under the generic name. I apologize. Actually, you know what, we'll try lipitor right now. I'm sorry about that. Okay, so we see that there's a pills icon here as well as a little chat icon. The pills icon indicates that there's a prescription assistance program available for that particular drug. The chat icon indicates that there's a support page available for that particular drug. But right now we're going to click on the pills icon so we can check out the prescription assistance program. Okay, we can see that there's 3 programs available for Lipitor. We're going to scroll down to the bottom program. Okay, so we can see that this program is run by Rx Outreach Medications. The first box you see here is the contact information box. It'll give you the phone number for the program as well as the program website if there is one. You want to direct any questions that you have about the program to the pharmaceutical company. Below that, you'll see the application and forms section. This will have active PDF links which can be completed online and printed out. So you can find any the program application itself, the medication list for the program, and any other documents that may be applicable to that particular program. Below that, you'll see the medication section. This particular program just covers Lipitor, but you'll notice that some programs cover many medications. Below that, you'll see the eligibility requirements section. Eligibility is based on insurance coverage and income level, and you'll notice from program to program these requirements will vary. As I mentioned, the requirements are often based on an income level, and we actually have a federal poverty level income calculator here, which I'm going to show you how to use right now. So we'll click the FPL income calculator. Okay, so let's say we have a family of 3 with a yearly income of $47,500. And I'd just like to note before I calculate this, if you use commas in the FPL calculator, it won't calculate properly. So just make sure that you don't use commas. Okay, so we have a family of 3 with a yearly income of $47,500. We'll click Calculate, and we can see that this family would be at 236% of the federal poverty level. So we'll go back to the program right now and see if they qualify. So this program stipulates that the family or individual be at or below the 300% of the federal poverty level. And as we saw from the income calculator, that particular family was at 236% of the federal poverty level. So they would qualify at least based on that eligibility requirement. Okay, so let's say you have an individual or family that is slightly over the income limit by, let's say, 10 or 15%. You want to try and call the program and ask the program to make an economic hardship exception. If turned down, you can call back again. There is some subjectivity to the process, so you might get a representative on the phone that maybe has a kinder ear to what your issue is or whatever you're encountering. So what I'm getting at is just keep trying because like I said, there is some subjectivity to the process. If you are denied, you can always appeal. Not every drug will have a prescription assistance program. So if you go on our site and you look for a particular drug and you don't see it on there, you can always try and call the drug company and ask them to make an economic hardship exception. Okay, so below the eligibility requirement section, you'll see the application section. And it's an estimate that it takes about 2 to 4 weeks from the point of submitting the application to receiving the medications. Some programs have a pre-approval process of 1 to 5 business days. Filling out the correct information on the program application may expedite this process. Below the application section, you'll see the medication section. And this section will show where the medication is sent to, when the patient has to reapply, that sort of information. Below that, you'll see the additional information that we have listed, and that's just anything that we felt might be applicable to the program that doesn't fit in any of the other boxes that you see listed here. One tip that we have is to not print applications and hold on to them, and the reason being is programs are changing all the time. They close, new ones open, and sometimes eligibility requirements change. It's best to get a fresh application off the website each time you apply. So we've had people who printed 100 applications and then the program actually changed the next day. So those applications are now void. So just print them out as you need them. Okay, so that was the Prescription Assistance Program database section of the website. Next, I'm going to move to the $4 generic discount drug program section. So we're going to scroll back up to the top. We're going to access the Patient Savings tab again. And we just looked for a brand name drug search. Under that, you'll see $4 generic discount drug programs, and we'll select that. This database is a directory of all the discount drug programs for generic medications at major retailers. Most range in a price from $4 to $15 for a 30 or 90-day supply. There are a number of search options available. You can search by state, zip, drug, or store. And just for ease of use, we'll try a state search right now. And we'll try one for New York. So we've chosen New York, and we can see that there's 22 discount drug programs available for New York. To the left, you'll see the store name. In the middle, you'll see the program name. And to the right, you'll see the program details. As you notice, each program has their own specific details, so you just want to go in here and check them out individually and see which one works best for you. If you click the store name here, you'll see that it's actually an active link, and that will just give you a little bit more information regarding that specific program. Okay, so that was the $4 generic discount drug program database on our website. Next, I'm going to move to the application assistance database. Okay, so we'll scroll back up to the top. We'll access the patient savings tab again. And we just selected $4 generic discount drug programs here. Right under that, you'll see help with prescription assistance applications, and we'll select that. Okay, so we just saw all those prescription assistance programs, and you saw under the printout section that you can actually get the application to apply to these programs. Applications can be complicated for patients and time-consuming for professionals. So this directory lists nonprofits that help people apply to prescription assistance programs. They do this for free or for a very small fee, and it varies from organization to organization. Unfortunately, it cannot be done over the phone. Within this database, you can search by zip code or state, and the programs are listed alphabetically by city. It is a non-comprehensive list, so if you see a program that's not listed, please let us know. Okay, so we'll try a state search within this application assistance database, and we'll try New York again. Okay, so we can see that there's 8 stations that help with application assistance in New York. It's a pretty simple database, and you'll notice that most of our databases model each other. To the left, you'll see the program name, and to the right, you'll see who the program serves. If you click on the program name, it will just give you a little bit more information specific to that particular program. Okay, so that was the application assistance database on our website. Next, I'm going to move to the free low-cost and sliding scale clinics database. So I'll scroll back up to the top. Under patient savings, we just looked at help with prescription assistance applications. Directly under that, you'll see free, low-cost, and sliding scale clinics, and we'll select that. This database lists 14,000 clinics across the United States. It includes dental and medical centers. It also includes women's health centers and STD testing facilities. This is a great database for those with medical insurance but not dental insurance. It's also good for those without a primary care provider so that they can get a prescription. And it's also a good option to check instead of going to the ER, because we all know that you can rack up some unexpected ER costs unintentionally. Okay, so let's try a medical clinic search within this database. So we'll click medical clinics. And we'll try a state search again for New York. Okay, so we can see that there's 566 free low-cost or sliding scale clinics in New York. This database, like the other ones, is pretty simple. To the left, you'll see the clinic name, contact information, website, they have it. In the middle column, you'll see the eligibility requirements for that particular clinic, and to the right, you'll see the details column, which outlines services, hours, service area. And you'll notice eligibility, services included, will vary from center to center. So you really just want to take a good look at what one would fit you best or your patient best. Okay, so that was the free low-cost and sliding scale clinics database on the website. Next, I'm going to move on to radiology imaging centers database. So we'll scroll back up to the top. We'll access the patient savings tab again, and directly under free low-cost and sliding scale clinics, you'll see radiology imaging centers, and we'll select that. So within this database, it's a compilation of nationwide radiology facilities across the United States. The exams we list are MRI, CT, CAT scan, ultrasound, mammography, and X-ray. We get the pricing for these procedures and facilities when we're able to, and all the prices are cash and self-pay prices. Cash prices are used for those without insurance or those who do not wish to use insurance. We also list if the facility has a payment plan, a discount, a financial assistance program, or indigent care. And we define indigent care as free care to those who cannot afford it. Like the other database I showed you with the application assistance, this database is non-comprehensive, so if there's a facility or area of interest, please let us know and we'd be happy to research that area. Okay, so let's try a state search within this database. We'll select state search, and you can see that there's a limited list of procedures here, so we'll choose MRI brain without contrast. And we'll select New York. Okay, so we can see that we have listed 201 facilities that perform that particular procedure. To the left, you'll see the imaging facility's name, as well as any contact information and website for that facility. To the middle column, you'll see a fee, and that would be the fee for that particular exam that we have that we selected in the search options. And to the right, you'll see a financial support, what financial support that particular facility has available. So we can see that this facility does the exam for $465, but they don't have any financial support available. Okay, so what happens when we select a facility's name right here on the link that's provided? So we see a little bit more information regarding that specific facility, including the whole price list. And as I mentioned before, you'll notice some facilities will have all the prices, some won't have any, and that really just depends on whether they list those prices on their website or if they're willing to provide them to us. This one most likely listed them on their website, so you can see that we have a full price list for it. So if you scroll below the price list, you'll see any additional services offered by the facility. If financial support is checked off here, it just means they have one of those 4 options of financial support I outlined earlier. You'll see an accreditation checkbox here if the facility is accredited by the American College of Radiology. And you'll see an open MRI checkbox here if the facility has an open MRI or an open bore MRI. Below that, you'll see some free screening categories. In some facilities, mostly hospitals, might have free screening programs for those that qualify. So if that particular facility does have a free screening program, you'll see that check down there below as well. Okay, so that was the Radiology Imaging Center's database on our website. Next, I'm going to move on to the coupons, rebates, and more database. So we'll scroll back up to the top. And right below Radiology Imaging Centers, you'll see coupons, rebates, and more. And we'll select that. This database is used for prescriptions and over-the-counter medications and supplies. They might provide a discount, a free sample, or a rebate. You can search by name of product or category, and the coupons will link up to the manufacturer's page. Right now we'll try a category search for respiratory disorders. So we'll select search by category, and we'll scroll down to respiratory disorders, and we'll select that. So we can see that there's 1,540 coupons, rebates, and more offered for that particular disorder. So we'll scroll down, and you'll see all the coupons listed here. You'll see the coupon name, when the coupon ends, and what the offer that the coupon is providing, as well as a link to the manufacturer's website. And you'll notice that these icons are appearing again. So this particular drug, Adcirca, has a coupon for it, but also you'll see this pills icon here, which means there's a prescription assistance program available for it as well. So you want to check out all the options and see which one, if generally a prescription assistance program would offer more assistance than a coupon, so it's worth checking out the prescription assistance program before you go and use the coupon, because as I said, it may provide a better discount on the drug that you're looking for. Okay, so that was the coupons, rebates, and more section of the website. Next, I'm going to move on to the diagnosis-based assistance database. So we'll scroll back up to the top. We'll access the patient savings tab again, and we've exhausted this whole left column here, and we're going to move over to the middle column, and we're going to select diagnosis-based assistance. So as I outlined earlier, we had a database of PAPs, or prescription assistance programs, and you can find programs available based on the medication you're looking for. This models that database in a sense where you don't search for a medication, but you search for a diagnosis, and it will have the programs listed in the same way. So we'll try a search for, in a moment, we'll try a search for scleroderma. But aside from prescription assistance programs, the greatest sources of savings are diagnosis-based assistance programs. They provide financial assistance for costs associated with a particular disease, and for the most part excludes medications. They may provide assistance for travel expenses, supplies, durable medical equipment, medical testing, wigs, and even house cleaning services, copay cards, and assistive technology. You can search by diagnosis, state, or program name. You'll notice that national programs are listed first, and then state programs. Okay, so let's try a diagnosis-based search for scleroderma. So we'll go and select S, and we'll find scleroderma. So we can say that there's 5 diagnosis-based assistance programs for scleroderma. To the left, you'll see the program name. In the middle, to the left, you'll see a summary of the program. You'll see the services provided to the right and the area of service also shown to the right. You'll see that the national programs are listed first, and then it will list states alphabetically. If you click on the program name to the left, it will just give you a little bit more information regarding that specific program. Okay, so that was the diagnosis-based assistance section of the database of the website. Next, we're going to move on to diagnosis information pages. So we'll scroll back up to the top. We'll go to patient savings, and we just selected diagnosis-based assistance. And you'll notice right above that, you'll see diagnosis information pages, and we'll select that. So what these are informational pages with links to pertinent resources. We partner with organizations and foundations, and we maintain the page together. So we actually do partner with the Scleroderma Foundation, and we'll take a look at that page right now. So we'll select Scleroderma right here, and you'll see that we've partnered with the Scleroderma Foundation. You'll see their icon at the top, and if you select any other diagnosis or disease on that directory before, you'll notice if we have a partnered page because it's logoed with who we've partnered with. Below the logo, you see a little summary about the Scleroderma Foundation, maybe a little bit about Scleroderma itself. To the right, you'll see links, and what these will do is actually bring you to links that the Scleroderma Foundation provided to us that they found to be most helpful for patients and those looking for information. The best part about this section of the website that I think is you can actually scroll down below the summary and links and see which medications are used in the treatment of scleroderma. And if you select one of these links, it will show you what type of assistance programs are available for those particular medications. So you can get a little bit of information about the drug or the disease or diagnosis you're looking for, and then you can go down below and see which medications are used in the treatment of that diagnosis and if there's any programs available for them. Okay, so that was our diagnosis information pages. Next, I'm going to move on to our camps, retreats, and recreational programs database. So we'll scroll up to the top, and we'll access the patient savings tab again. So we were just in this diagnosis specific box, and below that you'll see retreats, camps, and recreational programs, and we'll select that. So this database is used for to list camps and retreats for someone with a disease or a condition. We also list respite care programs. The assistance provided in some of these programs are often not only available to those personally affected with a particular disease, but there are also programs available for a loved one. And so you could actually search for a program that would help a child with a parent who has cancer. When most people think of camps, they think it's for children, but we also have camps listed for all ages and with services year-round. So let's try a condition search for scleroderma. So we can see there's a few camps programs available for scleroderma. You'll see the program name to the left, a summary of the program in the middle, where it accepts campers from, as well as the camp's location. And like our other databases, if you select the program name to the left, you'll just find a little bit more information regarding that specific program. Okay, so that was the camps, retreats, and recreational programs database on our website. Next, I'm going to move on to scholarships. So we'll scroll up to the top, we'll access the patient savings tab, and directly under retreats, camps, and recreational programs, you'll see scholarships, and we'll select that. Within this database, you'll see educational scholarships that can be applied to both high schools and colleges. It's good for students with a condition or diagnosis, and most can be used at any school. Much like the camps database, some of the programs can provide assistance even if the one applying isn't the one with the diagnosis. So let's try a condition search within this database. And we'll try a skin condition search. Okay, we can see that there's one scholarship available for skin conditions. To the left, you'll see the scholarship name. In the middle, you'll see a summary of the scholarship, and to the right, you'll see the residency requirements for that particular scholarship. If you click on the scholarship name, you'll just see some more information available particular to that scholarship. Okay, that was the scholarships database section of the website. I'm going to move on to the government programs section next. So we'll access the patient savings tab once again. We've exhausted this middle column, and we're going to move on to government programs. So this database lists government-sponsored programs at a federal, state, county, and local levels. It's cross-posted with the diagnosis-based assistance database that I showed you earlier, meaning that some diagnosis-based assistance programs are hosted by the government, so you might see them in both of these databases. Within this database, we list PACE locations, and PACE locations are a program of all-inclusive care for the elderly. It's a Medicare and Medicaid program that helps people meet their health needs, and it keeps people in their homes as opposed to nursing homes. Within this database, we also list SHIP sites, and that's the State Health Insurance Counseling and Assistance Programs site. Some of you may know this as SHINE or another acronym. And these are federally funded health advisory programs that provide health insurance counseling to Medicare recipients. Okay, so you'll also notice that there's a few other links within here. We have some Medicare information. If you click this Medicaid sites link, it'll just ask you what state you're from, and it will bring you to the Medicaid site for the state that you've selected. If you only want to, like, we have the SHIP programs listed within this state-sponsored program database, but if you just want to search for SHIP programs itself, you click here, and it will ask which state you're looking for, and it will bring you to the SHIP site for the state that you've selected. Okay, so let's select state-sponsored programs right now, and we'll do a state search for New York. So we'll choose the state here. And we can see that there's 66 state programs available for New York. You'll see the program name to the left and what the program provides to the right. If you click the program name, it'll just give you a little bit more information specific to that program. Okay, so we've gone over all the databases that we have listed on our website. Now I'm going to show you a few of the projects NeedyMeds has been working on. It's websites we've hosted and also just other resources that we have available on the website. So we'll scroll back up to the top, and we'll select the Home Page button. And right now we're going to take a look at the NeedyMeds project, Safe Needle Disposal. So we'll scroll down on the left-hand side here, and you'll see Safe Needle Disposal, and we'll select that. Okay, so according to the EPA, approximately 9 million people across the country use more than 3 billion needles, lancets, and syringes, also known as sharps, to manage their medical conditions. Considering the sheer volume, it's no wonder that safe disposal of sharps is such an important topic. If they are not disposed of appropriately, they can hurt not only sanitation workers, but can leave pets and people vulnerable to sharp stick injuries. And once someone is exposed, they are at risk of contracting life-changing diseases like hepatitis. For this reason, NeedyMeds hosts the Safe Needle Disposal website that provides locations for disposal sites in your area and types of programs available. So I'm just going to real quickly show you how to do a search on this website. So we'll select search here. And we'll scroll down and you'll see this neat little map where you can just select the state where your inquiry is based out of. So we'll select New York. At the top you'll see a summary of what New York outlines for their safe needle disposal programs, any information specific to the state. But below all that information, you'll see a listing of all the disposal locations for New York. It's pretty simple. You can see the location name, the address, any contact information if we have it. Okay, so that was safe needle disposal. Next, I'm going to move on to another resource that we have. Okay, so we're on the home page. We're looking on that left-hand column. We just looked at safe needle disposal. Right now we're going to take a look at PALS, or Patient Assistance for Lab Services, and we'll select that. Okay, so what is PALS? It's a service that offers 85 commonly ordered blood tests at a significantly discounted rate, often ranging from $5 to $15. PALS is a service in collaboration of the Own Your Health Partnership and NeedyMeds. Okay, so how does this program work? You want to print out an order form from the website, fill it out, and have your provider sign it. You submit and pay up front, and all the prices are indicated at the bottom of the order form and also on the PALS website. So when you print out that form, you'll see that there's information for you to put in your credit card information. So when you send it in, they have that available. There is a one-time $15 fee for shipping and processing, and this fee is the same no matter how many tests you order. After you submit the completed order form, within 2 weeks, you will receive a box with information on where to go to have your blood collected. You want to bring the box and all its contents. You will receive your results within 2 weeks, and a copy of your results is sent to your provider if they request them. You can also get your results on the website. So when you get that box, you'll receive some login information, and when your test results are ready, you can actually log into the website and check them out. Clinics may request bulk information boxes as a service to provide to their patients, and this can also be requested via the PALS website. Okay, so that was PALS, or Patient Assistance for Lab Services. Next, I'm going to show you HealFunder, our crowdfunding platform. So we're going to move back to the NeedyMeds website now. We'll scroll up to the top. We'll access the Patient Savings tab. And all the way to the right, you'll see HealFunder under Additional Resources to Lower Costs, and we'll select that. So as I mentioned, this is our crowdfunding platform. It's like Kickstarter or Indiegogo, if you're familiar with those crowdfunding platforms, and it's used to raise money for medical bills. Patients can fundraise to pay for medical bills already incurred or something that they are saving up for in the future. And organizations can use the platform for their fundraisers as well, and will help you promote it on social media. So HealFunder is unique from other crowdfunding platforms in the sense that it verifies the diagnosis by getting a signature from the person who's hosting the campaign or who the campaign applies to. We'd get a signature from their provider. We also pay medical bills directly. So a common stressor in these crowdfunding platforms is people will donate. They don't know if their money's going to be sent where the campaign says it's going to, and we actually do that ourselves just to make sure that anyone who does donate knows that their money is going where it's supposed to go. It can be used for medically necessary procedures, cosmetic procedures, or even orthodontia. Okay, so that's HealFunder, our crowdfunding platform. Next, we're going to move back to the home page, and I'm going to show you a new website that we actually just added about a week or two ago. And it's the beta version of the website, so just bear with me if you're playing around on it later, because there is some things that we're still working out on it. So, okay, we're on the home page right now. You'll see this big kind of what's new box, and you'll see Health Web Navigator here. We'll select that. So this is the new website project we've added. It's, as I mentioned, it's called Health Web Navigator. And what it's used for is what we have professional reviews of health-related websites to help you find the best, most medically reliable information. It has written and numerical reviews on the websites we list. Reviews are performed by medical and consumer professionals, such as doctors, nurses, nonprofit executives, web designers, psychologists, and consumer advocates. So we really have a range of opinions there just to make sure that if you're looking for a particular website, you can know how accurate it is based on a degree of professional opinions. Medical reviewers check sites for medical accuracy, and consumer professionals check the site for ease of use. So I'll show you how to do a simple search within this website right now. Okay, so we're on the home page of Health Web Navigator right now. We'll go to Topics. We'll select Physicians. And you can see there's a couple of subtopics below. And we'll try making appointments and second opinions. So we can see that there's 12 websites that we have listed for making appointments and second opinions. They're all listed below. You'll see the name of the website here, the average rating of the website, an objective description of the website, what they do, what services they may provide. If you click this visit website link, it'll bring you to bestdoctors.com or whatever website you're looking at. If you click this read review box, which we'll do right now, you can actually see what the professionals have said about this particular website. And we have 3 reviews for this site right now, 1, 2, 3. And to the right here, you'll see the rating details. So as I mentioned, they provide a rating based on their summary, which you see to the left, as well as a numerical rating to the right. And that the rating details to the right is just the average of all the ratings that the professionals have provided for that particular website. As I mentioned, this is the beta version of the site. We'll be toying with it, just improving on it as we go. If we return to the home page now for this website, you'll see that there's a please help us evaluate this website by participating in a short survey. So we'd love to hear any feedback or any websites that you'd like added to this website for us to review. Okay, so that was Health Web Navigator, a site that you can go to see reviews of other healthcare websites. So we're going to return back to the PowerPoint right now. And I'm going to tell you a little bit about the NeedyMeds drug discount card. Okay, so this is the NeedyMeds drug discount card. So what is the NeedyMeds drug discount card? Users can save between 0 and 80% off the cash price of prescriptions, over-the-counter medications and supplies written as a prescription, and even pet prescriptions at the pharmacy. And you'll notice I said 0 to 80%. Sometimes you'll receive a 0% discount, sometimes you'll receive it 80. So we don't just want to just say you're going to get 80 every time. So we just like to cover ourselves with that. It will vary from pharmacy to pharmacy and from day to day, that particular discount. Not every product is discounted, and the card only works for brick and mortar pharmacies, not online pharmacies. Last month it saved consumers nearly $4 million. The card is used 85% of the time it is presented to a pharmacist. So how does the card work? Pharmacies negotiate discounted prices with an adjudicator. Discounts change frequently. They vary from month to month and from pharmacy to pharmacy. So try the card each time you make a purchase. There are no eligibility requirements, no registration, no activation, and no application. There's many drug discount cards out there. So what's the difference about the NeedyMeds card? First, it's free to obtain and to use. Second, we do not collect any identifiable information about users, so it's totally anonymous. We don't sell your info to third-party marketers, and we only track dollar amount of savings and the number of times the card is used. Third, although we earn a small transaction fee each time the card is used, we don't try to maximize our own profit. We are a nonprofit and are in this to help patients, and that means we pass greater savings to the consumer. The small transaction fee we earn helps us with the administration of the card and the toll-free helpline. The card never expires and can be shared with your family members and friends. Just bring your card and valid prescription to the pharmacy. It's accepted at over 63,000 pharmacies, including all major and local chains. If you ever have trouble using the card, or if a pharmacist gives you a hard time, you can always call the number on back of the card. Okay, so who can use this card? Anyone. It fills a gap where someone might not be eligible for a prescription assistance program because of citizenship status, insurance coverage, or income level. Anyone can use this card. The only rule is that it cannot be combined with insurance, a prescription assistance program, or a coupon. And that's not to say if you have insurance you can't use the card. You would just be using the card instead of your insurance. So if you're uninsured, you can use the card at any time. If you have public or private insurance plans, you can use the card instead of your insurance if, for example, your medication is not covered under insurance, your copayment or deductible is too high, you're in a coverage gap like the Medicare Part D donut hole, or you've exceeded a cap for drug coverage. Okay, so how do you get your NeedyMeds drug discount card? You can print one out from our website by accessing that link, and I'll show you how to get there on the website in a moment. If you or your patient doesn't have access to the internet, they can always send a self-addressed envelope, and we'll get a card out to them usually within 2 weeks. If you're an organization, you can request a bulk amount of cards from our marketing representative. Okay, so for the drug discount card, we actually have some handy tools available for it. We have a drug pricing calculator, a pharmacy finder, and a drug discount card app for smartphones. And I'm going to show you how to find those tools right now. Okay, so we're on the NeedyMeds homepage right now. We're going to go to the Patient Savings tab. All the way to the right, you'll see the NeedyMeds drug discount card link, and we'll select that. Okay, so one other resource while we're on this page is if you can't get a mail, if you need a card now and you don't have time to mail something in, don't have time to order one or pick one up from your healthcare provider, you can actually select this link right here, and it'll open a PDF, and you can actually cut the card out from that printout that you've provided yourself. You can fill out information here to get an order and select your card design as well if you wish. Below that, you will see that we have a pharmacy search option. And what you do is just input your zip code and any other information that you see fit, and you can actually see what pharmacies are available within the area of the search information that you've input. Below the pharmacy search option, you'll see a drug pricing calculator, and I'll show you how to use that real quick. So we'll select the drug pricing calculator. And we're not there yet. You just want to click this proceed directly to the drug pricing calculator link. Okay, so this is the drug pricing calculator. Step 1, you just select your drug. Step 2, you can select your pharmacy or pharmacies up to 5. You want to input the quantity of the drug you're looking for as well as the day's supply, and then below here you'll click price, and you'll see a results list listed to the right. And just to give you a little hint about this, it only lists the prices for that day, and it's an estimate price. So let's say you looked up a drug and on Monday and you plan to go pick it up on Friday. That's probably not a good idea because the price could change in that time. So your best bet would be just to check that price for the drug you're looking for as well as the pharmacy, and just to make sure that you're getting the most accurate price available for that time. And as I mentioned, it is an estimate price. Okay, so that was the drug pricing calculator. We're going to move back to the home page, and I'm going to show you where to access the drug discount card app. Okay, so we're on the home page. We'll scroll down to the left, and you'll see the NeedyMeds drug discount card app. What's good about this app is it actually includes the pharmacy finder that I showed you below. So if you're on the run, you don't have time to look at the website, you can actually just open up the app and do the pharmacy search there. And another great thing about the app is that you can actually access a virtual drug discount card there. So let's say you forgot your card at home. You could just pull up the card on the app and use that instead. Okay, now I'm going to show you a few advocates resources on the NeedyMeds website. So we're at the home page. We'll access the Advocates tab, and we'll select PAN, or Patient Assistance News. So this is PAN, or our Patient Advocates newsletter. It's used if you want to keep abreast of resources and articles related to patient advocacy. You can sign up for a newsletter here as well as access archives from old newsletters. Within this newsletter, you'll find new programs that we have listed, any NeedyMeds news, updates on our resources, new databases we've added, or any partnerships that have come about. Okay, so that was PAN, our Patient Assistance News, our newsletter. So we're going to access the Advocates tab again, and we're going to look at PAPIS, or Patient Assistance Program Update Service. And if you haven't noticed, we're big on acronyms here. Okay, so this is PAPIS, or Patient Assistance Program Update Service. If you sign up for PAPIS, we send out alerts when a prescription assistance program is updated. So as you recall from the beginning of my presentation, we went over the prescription assistance program database where you look up the drugs and the programs and the eligibility requirements, all that sort of thing. So let's say if you're processing a lot of applications or you're just processing one application, you want to keep up to date on any changes that may have occurred for that particular drug. If you sign up for PAPIS, it will let you know, let's say for instance, if the eligibility requirements have changed for a medication that you frequently apply to. So you're not spending your time digging through the database, seeing any minute details that might have changed. This update service will do that for you. Okay, so that was PAPIS, or Patient Assistance Program Update Service. We're going to move back to the Advocates tab, and we'll go to DAPIS, or Diagnosis Assistance Program Update Service. So much like our Patient Assistance Program Update Service, if you're looking at diagnosis-based assistance programs, and there's one that you look at in particular, or a group of them that you may look at, this will, just like PAPIS, show you if any changes have occurred to the program, such as eligibility requirements, if the program's gone, if a new one comes up, that sort of thing. Okay, so that was the Diagnosis Assistance Program Update Service. We're going to move back to the Advocates tab for our final Advocates resource, and that's PAIR, or Patient Assistance Resource Education. If you work in a healthcare facility, then this may be of interest for you. It's a self-paced online tutorial to teach healthcare workers how to find assistance for patients. It's similar to the webinar I'm performing right now, but it just verifies that whoever's taking the tutorial can find resources adequately on our website. And when you're finished with the tutorial, we actually send you a neat little certificate as well, just to show that you've actually completed the tutorial. Okay, we're nearing the end of my presentation. I just have one other resource to show you back on the PowerPoint. And that is PAP Tracker software. So what this is software that eliminates some of the administrative process related to applications. So when you'll print out an application for a program, you'll see that there's a lot of stuff to fill out. And if you're processing a lot of applications for one individual or a lot of applications for many individuals, this may be of use to you. As I mentioned, it streamlines the administrative process. It autofills fields based on the information you've already input. So let's say you've input a patient before, you'll open up a new application, take that patient's information, and it will input it into the application automatically. It has application status tools, such as when you need to resubmit the application or when the patient needs to refill their medications. It also serves as a virtual file cabinet of sorts, storing your old and new orders. So you're not cluttering up your physical file cabinet with all those applications. Okay, we do have some partnership opportunities available. We can do customized drug discount cards, webinars, much like the one you're seeing right now, a disease information page. You guys already have one with us, but if you know someone who would see a benefit in that, we'd love to hear about it. And we also do some cross-posting of each other's resources on our websites if that's something that interests you. We also have a volunteer ambassador program. We are located in the North Shore of Massachusetts, so we can't always get across the country to relay our resources to organizations. So if you're out there to some place that we can't reach, we would love to enlist you as an ambassador to go to organizations and talk about what NeedyMeds has to offer. Okay, so that wraps up my presentation. My contact info is here, as well as our marketing representative's contact info if you need any literature. I'll now open up for any questions that you may have.
This is Mary Beth. Can you hear me?
I can hear you.
Okay, great. I just wanted to make a comment. touched on both of the questions that I had. One was about the coverage gap with the donut hole. That that's huge for so many people. They fall into that coverage gap and they have to pay for their own prescriptions. So this will help. This program can help with that.
Yep, it certainly will, and they can. And I recommend just trying that card out just to see what the best price is every time you go, and also checking if there's any prescription assistance programs available as well for whatever drug they're looking for.
Yeah, that's awesome news, and I will definitely be spreading that word. And then you mentioned animals. That's with the NeedyMeds Card. You can use that to get a prescription for your dog or...
Yep, that's correct. And I know there are a few pharmacies. I believe Walmart used to allow our use our card for pet prescriptions, but I don't believe they do anymore. So you just I know there's a couple pharmacies. I apologize, I can't name them off the top of my head right now, but most of them should accept the card for pet prescriptions as well.
Okay. Is there a way to look that up on your website, or?
I'm not sure, but I'd be happy to send you the information of the ones that do and don't, or the ones that don't, rather, just so you can get a better idea of that.
That could be very expensive. I know some people get pet insurance, which can certainly help.
Yeah, and a lot of people see their pets as their children, so we understand that need.
Exactly.
Okay, are there any other questions?
It's been enlightening. I have worked in this organization for the last 4 years, and I definitely know a lot more about NeedyMeds, and that will help me tremendously in my work here with scleroderma patients.
Well, I'm glad to hear that, because that means I've done my job.
Yes, you have, and I will definitely be using the different information that I learned today with our patients, so I appreciate it. Thank you for speaking with us and for being on the call today. We just learned so much. It'll be a valuable resource for many. So.
Great, thanks, Mary Beth, and I'd also like to thank the Scleroderma Foundation for hosting me today. Have a great day.
Thank you. Tune in again the third Tuesday of each month for the next edition of Tri-State Connect. You can reach our office at 800-867-0885. I hope that the sun is shining where you are and you have a great day. Bye-bye.